Let's start. Hello everyone. Good morning. Boy. I'm the one
Voice is
call on the
cracking. Voice is cracking.
Hello.
Yes.
Vijay sir, can you like start with your like things because like there is having some network issue, so you
Okay.
can start.
All right.
Yeah.
Okay.
Yeah.
Good morning, friends. I welcome all the dignitaries, all my friends and senior members. To begin with, Professor Unnikrishnan, my teacher, who's currently President of Vascular Society of India. Dr. P.C. Gupta, who's President-elect of Vascular Society of India. Dr. V.S. Bedi, is a very senior member and very instrumental in the development of society. I have close friends like Dr. Sanjay Desai, who's HOD at Ramaiah Medical College, Dr. Sritharan, who's HOD at Madras Medical College, and Parveen Jindal, a very live, famous personality in Uttarakhand. Is a vascular surgeon promoting vascular surgery in that region very hard. I welcome all of you, friends. As you know, today is a very special day for all of us, for all the vascular surgeons. 6th August 1994, 28 years ago, only 34 surgeons, like minded, with the aim of developing vascular surgery in the country, got together and formed a society called Vascular Society of India. See, the society 28 years was so small, only 34 members. Vascular surgery was naive and a very primitive stage at that point of time in our country. But today, there's a sea change. Today, when you see the number of surgeons are more than 625, and the surgeries also changed so much that virtually everything is possible in this country to treat all kind of vascular diseases with a great success. So it's a contribution from all of us to reach to these heights, and we strive. We will work very hard to contribute to do the best to reach the greater heights. Today, this program is basically for the people in the society to make them aware about what is vascular surgery, and also to certain extent to certain family physicians to make them aware about the vascular diseases and its correct treatment. Hence, we have taken a very elite and experienced panelist to share their knowledge about the common vascular diseases. Before we share that common questionnaire and inform people about that, I would request our Honorable President, Vascular Society India, Professor Unnikrishnan, who is also awardee of Dr. B.C. Roy, very famous award given to, highest award given to any doctor in the country, to say a few words, kind of a deliver a keynote address on a today's auspicious day. Over to you, Professor Unnikrishnan.
Thank you, Vijay. Thank you for the kind introduction. And friends and all my panelists, I'm immensely delighted and privileged to be part of this National Vascular Awareness Program. As Dr. Vijay has already said, from sporadic cases somewhere here in the country, now from 1994, since the Vascular Society was formed, vascular surgery has grown leap and bounds. Now we have best medical management, highest order endovascular procedures and surgery, and open surgery, depending upon what patients require. The number has gone to 600, and I think, except some places here and there, we are endowed with vascular surgeons. And now it's beyond doubt has become a standalone specialty and recognized. However, we need to introduce to the public nationally what are the vascular illnesses, what are their symptoms, what are the treatment options available, and when they should go to a vascular surgeon. Because there is a lot of overlap in the treatment for vascular diseases. Initially, it could be seen by a general physician or a cardiologist or a neurologist. Now, coming to the society activities, learning, then teaching, and spreading the awareness. These are the three components of a society and its members. In that, the learning and teaching of highest order is going on, be it medical management, be it endovascular, or even open surgery. And the coming to the and of course we have been doing good deal of research, and we have a journal to publish our own articles, and of course we have the freedom to send it out, so that the research and publications are also going on very well. The awareness has not been so intensely taken up by us till we felt that the patients have the best chance of getting their problem, the limb saved, the organ saved, life saved with a vascular surgeon who are methodical in their approach to the patients. And today, from Dehradun to Kanyakumari, I mean, several dozens of doctors, vascular surgeons, are making various kinds of awareness programs. And to for the icing on the cake, we have the Voice of Healthcare helping us go nationally for the awareness uh, program on this precious day of Vascular Day for us, which was the day when vascular surgery was born in 1994. I was blessed to have been there as a founding member, and I'm grateful to the society for even making me the president. And thank you once again, the panelists. I think without much ado, I would request Vijay to go on with the program of panel discussion. Thank you.
Thank you very much, sir. Indeed, it was a good introduction about the vascular surgery in this country. Uh, by the media of asking various questions to the panelists, our objective is to create an awareness, to spread an information to the society by and large about vascular diseases. I forgot to mention one of the panelists, Dr. Sekhar. Raghuram Sekhar is a close friend, senior vascular surgeon, and who's heading Department of Vascular Endovascular Surgery at Kokelaben Institute at Mumbai. To start the panel discussion, the first question I have is for the President, Dr. Unnikrishnan. Sir, can you elaborate? Can you tell people what is vascular surgery? Because people do not know about vascular surgery in general. So we would like to hear you. What is vascular surgery to the people?
Thank you, Vijay, once again. The blood which is pumped by the heart to reach every cell, every organ, every system of the body through what I can call a large set of widely distributed pipeline consisting of pure blood vessels, impure blood vessels, and lymphatics, and their diseases and the problems they can have, whether with aging, trauma, or if it's impure blood vessels, you have varicose veins, venous thromboembolic disease. Of this, the most important and more widespread would be the venous diseases apart, the atherosclerosis, which forms cholesterol or fat deposition in the inner side of the pure blood vessels, and which supply each organ. When they get diseased, the blood supply is less, so oxygen, the metabolites, products, carbohydrate, all the hormones, everything is not reaching the tissue or the cell. There will be dysfunction of any organ. The blood is being pumped into maybe legs, maybe kidney, maybe the heart or brain. But vascular surgeons will be looking at carotid vessels, and all the peripheral vessels, and inside the brain and inside the pericardium, including the proximal ascending aorta, we do not, it's not our domain to go. So basically, various causes can produce diseases in the pure blood vessels, but mainly it is atherosclerosis, as I mentioned. Tracheasus, arterial inflammation can be another cause. Trauma can cause difficulty. So basically, the pure and impure blood vessels, when they are diseased due to a multiple causes, give rise to serious problem, and they need to be corrected, maybe initially with medications, and if that is not being controlled, using endovascular procedure surgery, which is now in the forefront, rightly so, because a blood vessel infliction can best be managed through the blood vessel. And if that does not work, or if there's problem, we can still go and lean on to the open vascular surgery. Thank you.
Thank you, sir. Now I have a request to Dr. Bedi. Many people in the society also do not know what is vascular surgery and what is endovascular surgery. Sir, can you enlighten us? Can you tell us the difference between vascular and endovascular surgery?
Yeah. So as surgeons, we evolved from general surgeons to vascular surgeons. We were initially an offshoot of cardiothoracic and vascular surgery. And today we are basically what we call the vascular surgeons who deal with, originally we started off as vascular surgeons who deal with blood vessels and treat them by open surgery, which means doing an open bypass, open repair, open, opening of the arteries and cleaning out clots and everything and all. So this was all done by an open technique, which was there, which involved a morbid procedure. Like when you understand cardiac surgery, when you do an open heart surgery, you do what is called a CABG and all those things. The same way over a period of time, as Dr. Unni also elaborated, that endovascular surgery came in, where in fact we started doing a lot of these procedures without making any cuts. So same thing like the cardiologists do an angioplasty for the heart, the same kind of things that we do for the blood vessels in the rest of the body. We can put in stents, we can put in bare stents for blockages, we can put it covered stents for, when there's a dilatation of some of the arteries become swollen up. So this is where endovascular surgery is involved. And I'm proud to say one particular thing, that unlike many other specialties, where you have two different people handling the same organ or viscera, we are the only specialists who manage patients with vascular diseases either with an open surgical technique or with an endovascular technique or even a medical management. So we are three specialties rolled into one, as compared to when you look at the cardiologist, you have the cardiac surgeons, you have the urologist, you have the nephrologist out there. So probably I think we are one of the niche specialty out here which can decide what is the best course of the patient, rather than using the same screw for hitting every place. You can decide you can tailor make, what is the ideal solution for your patient. So you can use a combination of vascular, endovascular, or sometimes what we call a hybrid approach, whereby a minimum approach and all, with a small bit of surgery, you can do a major procedure, which earlier used to take many, many hours and with a high rate of morbidity and mortality. So today, a good vascular surgeon is very well accomplished in treating these patients by minimally invasive techniques, by maximally invasive techniques, as well as by medical management also. Thank you.
Thank you, sir. Dr. Raghuram Sekhar. People have lots of myth. They say NUS. NUS is a misnomer. All of us have experienced people coming to your office and saying NUS ka problem hai. So can you tell us what do we mean by artery and vein? Or is it the same as NUS?
Yeah.
Because
So our human body has, yeah. Yeah. So our human body has two types of tubes that are there to transmit blood to various parts of our body. The arteries are the tubes that transmit clean blood from the heart to our various vital organs and the periphery like limbs. While the veins, as you see them as these blue projections under the skin sometimes, are tubes that take back waste blood from the rest of our body to the lungs, where they are purified, and then subsequently they are sent back to the heart and then they are pushed through into the arteries again. So these are the two types of blood vessels, the arteries and the veins, one carrying the clean blood and the other returning the utilized blood in our body.
Okay, thank you, Dr. Raghuram. Dr. Bedi, sir, what are the common arterial diseases that most of the vascular surgeons treat? Can you please tell
Yeah,
us, sir?
yeah, sure. So, depending on the age bracket of the patient, the sex of the patient, and all, we see different kinds of spectrum of diseases. A younger subset of patients who are there in their 20s, 30s, and all, who are chronic smokers, they are the ones who present with blockages of these arteries and all, especially of the medium size and small arteries. And that is what we call also Berger's disease. In case of male patients, we see a lot of patients with Berger's disease, especially in the south. Then in the younger females also we see what is a disease which is called aortoarteritis, where this affects the medium and small size vessels, and it's an inflammatory disease which is there. That means due to some kind of an inflammation in the body, these kind of diseases. But the major chunk of patients that we see are basically atherosclerotic diseases. What we say is patients like who have blockages in the heart, the same kind of blockages which can happen into the arteries which are supplying blood to the legs, as well as sometimes in the arms also, much more common in case of the legs. That means from the tummy, directly the main artery which takes blood down to the rest of the body lower down. The aorta can get blocked, the vessels which are leading down to the legs can get blocked. So these are some of the commonest blockages. Then, of course, the second one, which Dr. Unni also alluded to, was blockage in the arteries to the neck, which supply blood to the brain, which we call the carotid arteries. Now, these are again very, very common kind of lesions which are seen, and the patient sometimes present with a severe kind of a stroke. That means one side of his body gets completely paralyzed because of a blockage in the artery and some clot going up into the brain. And the same way in the lower limb patients who are diabetics, who have kidney failure and all, they develop very severe calcification, and many of them then present with gangrene if they present late, or in the early stages, of course, they present with completely leg becoming completely, very, very painful and all, and becoming blue, at times black if it takes a little longer time. So all these kind of blockages, which can be either acute or they can be what we call chronic, which means over a period of time. So a patient who has difficulty in walking, he initially starts off and suddenly finds that after walking half a kilometer, his legs start hurting, what we call intermittent claudication. So these are generally because of atherosclerotic problem, where because of the cholesterol which get deposited in the arteries, these vessels tend to get blocked, and then you need to probably fix these patients either with medicines, with exercises, or some kind of an intervention. Thank you.
Thank you, sir. Dr. Parveen Jindal, we got some basic information about what is vascular diseases. But how would a person know? How would a society layman would know that they have peripheral vascular disease? How do they come to our office? You're not audible, but you have to unmute yourself here.
Yeah, sorry. Uh, the person who's suffering from peripheral vascular disease, I'll try to put them in two categories. Like Dr. Bedi has already mentioned in the arterial component. So most of this peripheral vascular disease, since it is focused on the lower limbs, so most of these patients, either young or old, younger patients we do see Berger's, and older patients we do see atherosclerotic disease. So these patients do feel a pain after walking a certain distance. Now this walking distance gradually reduces. That is what should be an alarming sign. And at the same time, if we talk about the venous disease, patients might have, bad looking green, black, tortuous veins, ugly sight on the legs with the skin color changes, and at times with the non-healing ulcers. So these are, they fall into the category of varicose veins, and sometimes similar patients also have swelling of the legs with temperature raised, with redness with them. That could be a first sign of a deep vein thrombosis, which is again a potentially life-threatening situation. So categorizing them into an arterial and venous, and at the same time, there's one more issue, like Dr. Bedi discussed. If you have something in the carotid vessels and patient lands up in stroke or at times TIAs, that is transient ischemic attacks, minor attacks of the brain, one should be alarmed enough to seek an opinion from a vascular surgeon and should not delay the call. Thank you.
Thank you. Dr. Sritharan. Dr. Sritharan is head of the Department of Vascular Surgery at Madras Medical College. How now tell us, with all these patients who come to us with various kinds of symptoms of peripheral vascular disease, do all of them require some or other kind of operation?
Thanks, Vijay. The indication for intervention depends on which stage the patient is coming. As Dr. Parveen told, the patient may come with a pain on walking. We call it as a claudication distance. That is the initial stage. And if that stage is ignored, the claudication pain, the walking pain, the distance is gradually reduces. The beauty about this pain is the patient can never miss this pain. Whenever the patient walks, he gets a pain, he stops for a while and then takes some rest and then again keeps walking. This we call it as a claudication pain, which the patient never misses. So patient who comes with a claudication pain, initially we don't do surgery or intervention on these patients. We do lifestyle modification. The one most important thing which causes the peripheral arterial disease is smoking. We ask the patient to stop smoking and especially do not use tobacco in any form, because if you ask the patient to stop smoking, they will use chew gums and other things. So we ask them to stop smoking and we improve their sugar level and improve the hypertension and reduce the cholesterol and encourage them to start walking and keep on walking. And once the patient comes with an ulcer which is not healing or blackish discoloration of the tissues, that is the stage when we intervene. And again, the intervention is not only open surgery. As Dr. Bedi told already, we do an endovascular option also, which is a pinhole surgery. Depending upon the lesion status, we either decide on an open surgery or an endovascular or a pinhole surgery.
Thank you, Dr. Sridharan.
Thank you.
Yeah, Dr. Sanjay, because of great development in medical technology and medical techniques, these days, most of the operations have become minimally invasive in all the different specialties. This is also true for vascular surgery. So please tell us, what is endovascular surgery?
Thank you, Vijay. Well, yes, like you rightly said, minimal interventions is the flavor of the day, and anything minimally done is obviously beneficial to the patient, and probably we can get away with lesser morbidity associated with major surgeries. As you're all aware that every structure in our body requires blood, and to survive, and nutrition should be delivered to each and every structure, whether it's the kidneys, it's the brain, it's the leg, it's the heart. So everything is through a channels of pathways. Now technology has grown so much that we can get an access into one of these channels, and once you get an access through the channel, obviously you can find your way to any part of the body. That is what the term endovascular means. That means you can get into these vessels, get into the artery. Maybe you can get into the artery from somewhere near the elbow or in the groin, and then reach out to till your brain, reach out to your kidneys, reach out to the toes. So through that you can find your way. It is just not just reaching out. Now the technology is that you can look inside the vessel. You have cameras which can be put inside the blood vessels, visualize what is going on. Ultrasonically you can break plaques within the blood vessel. So the term endovascular is get inside the vessel, and through that, once you get access, you can reach. Now just to give an example, if there is a narrowing of a kidney artery, we don't necessarily have to open the entire abdomen now, look at the kidney, look at the artery, and then repair the artery. We can get inside the blood vessels, say from the groin region. You get an access. From there, we push in what we call catheters or tubes inside, and then under radiological guidance, we check what is the structure, and from within there, you can open up with what we call balloons and dilate those blocks. We can put in stents there. There's many more newer technologies which is coming in, which can be done minimally. So endovascular is basically a minimal intervention to take care of problems which can avoid surgeries. And endovascular has grown so much in the last 20 years that I think most of us, 600 vascular surgeons across the country, 60 to 65% of our work is now endovascular, and that is good news to know that we can treat many of these diseases by minimal interventions.
Thank you, Sanjay. Dr. P.C. Gupta, uh, Dr. Bedi said that vascular surgeons, we are unique specialties. We are hybrid specialties. We are physicians, we are surgeons, we are intervention specialists. So tell us, who decides that what kind of treatment should be offered to a patient, because patient do not know where to go. So who is the right person to advise them? Please tell us. Unmute yourself, PC. PC, unmute.
Unmute.
Is you would unmute.
Thanks, Vijay. I think this is the easiest one to answer. I mean, it's really a no-brainer. A vascular surgeon or the vascular specialist is the only one who should be treating all vascular problems. And the reasons are very simple. He or she is the only specialist who is trained to provide medical treatment, provide endovascular treatment, provide open surgical treatment. And nowadays, we've even gone a step further. We do our own ultrasounds and actually make our own diagnosis, because quite often we can't rely on the ultrasounds done by the diagnostician. So a vascular surgeon is the right person. It's like if you have to go and buy any material and you have 4 varieties available in one place, that is the place you would go. So since a vascular surgeon has the expertise to offer any type of treatment, he or she will choose the treatment which suits the patient, not what he or she can do and suits him or her. So in one line, I would say vascular surgeons treat patients and not just lesions. Thank you.
I agree, Dr. P.C. Gupta. Vascular surgeons offer one-stop solution. Then people are confused. You see, let's say the very commonest problem of varicose veins, which is being treated by so many different specialists, from surgeons to radiologists to vascular surgeons and so many more. So please tell us that how do people should decide or where to go?
So Vijay, this is varicose veins is a problem which is, I think, grossly abused. And people go by advertisements, the promise of a laser surgery. So much of advertisement is there for it. Now, laser is a relatively easy to perform procedure. But in my practice, and I think many of us would agree with that, is that almost about 80% of varicose veins which are being treated by various specialists actually do not require treatment because they are not really varicose veins. And that, I think, if this can go to the public, or this can go to a lay person, I think this would be the most important message we can convey today, that we should treat patients only when they require treatment, not because I can do something. Just because I have a hammer in my hand, everything should not be a nail. And unfortunately, that is what is happening to varicose veins. All patients with any leg pigmentation, any small spider veins are being offered laser surgery, which I think is not fair to the patient and not fair to the society. I think all people with varicose veins, or if they think they have varicose veins, should approach a vascular surgeon, because they are the only people who will make the right diagnosis and then offer the right treatment to the patient.
Thank you, Dr. Gupta, for clarifying a lot of myths. So friends, if you have varicose veins, judge your doctor, choose your right doctor, go to right place. Professor Unnikrishnan, the next question for you. We know we just said a word about aneurysms. So tell us, sir, what are the common aortic problems that people should know, and what are those common aortic problems like aneurysms that vascular surgeons deal with? Sir.
Yeah, thank you, Vijay. See, aneurysm pertains to an increase in the size of aorta or a peripheral artery 1.5 times or more of its expected size or in the neighboring size of the aorta. What happens is, although we call at 1.5 times, it can be named aneurysm only when it reaches, say, a certain size the risk of its leaking or rupture occurs. Say, for example, in the abdomen, if it is reaching 5 to 5.5 centimeter, then the chances of leaking or rupture is very high. The point is, when it is within that 5.5 centimeter, even with or without symptoms, the surgery or endovascular procedure, both are applicable. We have to choose the patient, and then it can be performed with 95 or 96% success chance. Whereas if it leaks or ruptures, then I think there is a very high chance of patient losing the life, because it becomes an emergency surgery. There can be technical problem. It will be at the odd time. Blood may not be available. The graft may not be available. The prosthesis may not be available. So many things. Whereas in the peripheral arteries, again, the same picture, but comparatively, if you look at aneurysms, 95% belong to the aorta, various domains of, say, aortic arch, that is in the thorax, where the ascending aorta, the initial aorta, which runs just behind the sternum and to the right side, takes an oblique path to the left side of the spine and go to the chest. So that arch is called where the brain vessels and the hand vessels start from. Then it runs downwards in the left side of the chest. Then at the diaphragm, it becomes abdominal aorta. So thoracic aortic aneurysm, the critical threshold is 6 centimeter, whereas, as I mentioned, abdominal aorta, it is 5.5 centimeter. Currently, the open surgery definitely is in the back seat, and endovascular is in vogue. As my colleagues have mentioned, endovascular revolution after is evolved as the treatment form has made less stressful for the patient, and the recovery is faster. They can go back to work, and I think staying alive is important. If a procedure can have 97-98% success rate, whereas open surgery is only 80%, it's a big difference. So endovascular, as we have heard, is come as the first option, but there are other problems like the surveillance is a burden. Repeat procedures like endo leaks and other points can be occurring, and of course the cost factor is there. So aneurysm is to be treated upon diagnosis, and when the size is becoming 2 or 2.5 times, that is as the threshold I have mentioned. Thank you.
Thank you, sir. So, the audience, please remember the word aneurysm. If you or any of your relative is suffering from an aneurysm, as Professor said, if it is large in diameter and if it ruptures, death is almost imminent. So please see a vascular surgeon when you are diagnosed with aneurysm. So far we have discussed about arterial diseases.
There's an echo coming, Vijay. Echo coming.
Yes, sir. Is it still there?
Still coming. Echo still coming. I think everybody's voice is green.
Yeah.
Sandesh?
Yes, sir. Like we can do one thing. Like while you are speaking, like rest of the speakers should like switch off their like mic.
Okay. Please do so. Sandesh? I think look.
Yes,
Still
sir.
there is the same problem.
Can you fix it? Sir, you can try out exit from this and then re-enter. I can add you the same code, yeah.
So you think I should exit?
Sir, right now is fine.
So there's still echo.
Yeah, no echo, sir. Sir, you can like move on.
See, I think there's a delay in transmission. The whatever you speak.
Sir, you can exit then re-enter. Like that is the
Okay.
best option.
Okay. I think technology is my age weapon.
Still there is an echo, Vijay.
Sandesh?
What you can do, Vijay, you speak a sentence and give 10 seconds break. So you
Okay.
just hear double, but the matter is clear.
Yeah.
Sir, right now is okay.
Yeah, it's getting better.
Yeah.
So we move on to the next type of diseases called venous diseases, which are also very commonly prevalent in the society. And for that, I would invite Dr. Sritharan to answer this question: that what are the most common venous diseases that people present to us with?
Thank you, Vijay. The commonest venous disorder is a varicose vein. Varicose vein is a dilated venous channels. And as Dr. P.C. Gupta told, that is the most misused entity, because most of the patients who do not require any intervention get treated by other specialists. That is one thing. And the other thing is clot in the deep veins. We call it as a deep venous thrombosis, which is most sinister, and it can be life-threatening also. And these patients, they can develop sudden swelling of the leg. So any patient who develops a sudden swelling of the leg, they have to think in terms of a deep vein thrombosis and consult a vascular surgeon immediately for the life-saving measure. And so these are the two common conditions. One is a varicose vein, which is not so life-threatening, can be treated conservatively at times, and another one is a deep thrombosis, which is immediate.
Thank you. Dr. Sekhar.
Yeah.
We have discussed a lot about varicose veins. How do people know that they are suffering from varicose veins?
Yeah, Dr. Sekhar, can you answer? How do people know how they are suffering from varicose veins?
So these are permanently elongated, protruding bluish tubes that patients usually come with, typically in the legs. What the patient usually says is that he or she has visible veins which they can see in the leg. These ugly bluish protrusions. Typically associated with that is aching in the legs rather than the actual pain. The legs feel fatigued. There are cramps in the night. Patients come and say that the swelling is there in the ankles more towards the end of the day. Occasionally, these bleed, and patients come to the emergency with bleeding, and then you find that it's from a varicose veins. Advanced varicose veins also come. Patients would realize that their ankles are getting darker and darker, more and more pigmentation. And occasionally, we find patients come with a wound around the ankle, which has been there for a considerable period and has not actually healing. And those could be the typical pointers to the fact that the patient has varicose veins.
Dr. Vijay, please unmute yourself.
Yeah, thank you, Dr. Sekhar. Dr. Jindal, we'll be hearing a lot about varicose veins. Now tell us that all these patients who suffer from varicose veins, Do they need some form of treatment?
Thank you, Dr. Vijay. Actually, like this question has already been answered by Dr. PC, Dr. Sritharan. This is one of the most, I would say, abused disease by the non-vascular specialist. Just because of the availability of the gadgets, everybody tends to put their hand on treating these patients. But it's very, very important for the patients to know and for the doctors also to know which patients need treatment. The patient who's suffering from varicose veins. Now, not all of them need treatment. As a vascular specialist, we are probably in the best of the situation to assess and judge whether which patient needs surgical intervention, which patient needs medical attention, and most of these, or rather all of them, do need lifestyle modification. So my strong point to the patients and to the people is that every varicose vein does not need surgery at all. It's only when it is gets complicated and it's affecting your day-to-day life, that is the time when we should start thinking about doing some intervention, whether medical or surgical, or like senior said, endovascular therapy. But most of these patients, if they are in the early stages, they can be easily and very well managed with the lifestyle modification and the precautionary measures, or change in their profession and change in their habits, controlling their weights, controlling their habits, taking a good nutritious diet. So all these things, they can help in taking care of these patients.
Thank you, Parveen. Dr. Bedi, uh, tell us what is deep vein thrombosis. We have heard that deep vein thrombosis is a killer disease, and if you do not treat it rightly, you may lose life. Please tell us.
Yeah. So deep vein thrombosis is something which affects the veins, which basically the blood vessels or the tubes, as Dr. Sekhar put it, which carry the dirty blood back to the heart from the rest of the body. Commonly, what we see is deep vein thrombosis affects the lower limbs, and this can primarily be because of multiple reasons or unknown reasons. Number one is basically that if you're sitting in a position for a long time, which does happen many a times with patients who take these long flights to USA and all. The patients tend to get dehydrated, the blood becomes very thin. So this is what is called the economy class syndrome, where the patients are traveling for a long time, underhydrated, the blood becomes thin, and then they develop DVT. The second subset of patients is because of a strong exercise or something else which can happen. So these are some of the common things which are there. The third part is basically when you have what we call an unprovoked DVT. In this particular case, we need to rule out that it can be a manifestation of some other disease in the body. So there could be cancer lurking in the body somewhere, or it could be because of prolonged immobilization of the patient. If the person is very sick or something of the sort, these are some of the patients. So what we call cancer-associated thrombosis, immobilization, and various other things, which can produce sudden severe swelling of the lower limbs. Some of these patients, and that is where the fatality question comes in, that some of these clots can suddenly go and go into the lungs and immediately block the main arteries which take the blood, oxygenated blood, or the deoxygenated blood back to the lungs.
Or the deoxygenated blood back to the lungs.
We got echo again. So that is another thing which can happen. That is called a massive pulmonary embolism.
Another thing which
If
can
it
happen,
is
that is
not
called a
treated in
massive
time,
pulmonary embolism.
and the patient can die immediately because of that particular reason. So these are some of the dreadful diseases, and that is why it's been labeled as a killer disease, because if it doesn't really give too much of a time for the patient to be treated. So patient has to be expeditiously rushed to a hospital, has to be either treated very, very strong medicines to melt the clots, or sometimes even surgery is required to take care of these clots and all. So DVT is, that's why it's a major problem
That's why
and
it's a
sudden severe
major
swelling.
problem and sudden severe swelling.
It requires treatment in many cases, but just to allay the apprehension that not all deep vein thrombosis are potentially fatal. Some of the commonest ones, the infrainguinal, as we call it, which is in the thighs and the legs, they are the ones which can, if they are not that severe and all, they can be managed by medical management, even without admitting the patient to the hospital. So that is the brighter side of things for some of those patients. But again, it's very important to diagnose and treat the problem and treat the cause of the DVT also. That's very, very important. Thank you.
Thank you.
Thank you, sir.
Thank you, sir.
Uh, Dr. Bedi said about DVT. So, if you have a painful swelling, viewers, see a vascular surgeon to get a right advice.
Vijay,
You're
you are
muted.
muted.
Thank you, Dr. Bedi, for telling us what is deep vein thrombosis. So, viewers, if you have painful acute swelling, please see vascular surgeons as soon as possible. Dr. Sekhar will tell us how to treat those deep vein thrombosis patients.
Yeah, thank you, Dr. Vijay. I think at the start, one must know that this is a dangerous condition, though all deep vein thrombosis are not dangerous, but the ones that are there above the groin tend to the clots tend to travel to the lungs and cause what is called pulmonary embolism. So that is a dangerous condition. The other thing I'd like to add is that not the deep vein thrombosis is called a silent killer because only about 50% of them present with symptoms in the leg. The rest of the 50% get to be known only when the clots go to the lungs. So that is the danger of having deep vein thrombosis. As Dr. Bedi has said, there are two types of deep vein thrombosis. The small clots, which are there usually in the calves and thighs, can be treated with blood thinners. But the larger clots and the clots that are there in our groin and extending into the abdomen, the chances of them going into the lungs is more than 60%. So these require a vascular surgeon to use various instruments, various gadgets, various tubes and drugs to dissolve these clots and suck them out. So there's good treatment options available for deep vein thrombosis. Though, as Dr. Bedi said, all of them don't need this procedure, but it requires a vascular surgeon to actually decide who needs what type of treatment. So they are the best people to actually be treating this condition.
Thank you, Dr. Sekhar. As our panel is said, that if these clots they travel from legs to the lungs, it might create a serious situation. And could be fatal many times. So, Dr. Gupta, please tell us how to prevent clot migration from legs to the lungs. What is an IVC filter?
Yeah, thanks, Vijay. I think it's an important question, and since DVT is a potentially fatal disorder and it is fatal because clots go to the lung, there is a group of patients where we need to prevent or place devices in the major vein in the abdomen, which we call the inferior vena cava or the IVC. Earlier, of course, we used to do an open surgery and plicate to reduce the size, but now we have devices, what we call IVC filter, which can be placed through a tiny hole in the groin or in the neck, and this would trap all the large clots. In simple language, most people call it an umbrella. So it's an umbrella made of metal wires, which will trap any large clots from going towards the heart and the lung. The tiny clots can go, but they are not that harmful. Now, just for people to see what an IVC filter is, this is what it looks like. So it's loaded inside the tube, and you pull it out, and this is how it deploys. So this is an IVC filter, and any large clot, they will get trapped inside here, and only normal blood and the tiny clots would be able to go up. And this is what we call a retrievable filter, which means that within 6 weeks to 3 months, once it has done its job, it can be removed so that it doesn't remain permanently in the body. There is a group of patients where it might be required permanently and it can be left in place.
Thank you, Dr. Gupta, for showing a filter also. It was very illustrious and telling us about retrievable filters, because filters should be used only when they're required and should be removed once the purpose is served. From vein onwards, now we go on to the another small segment of vascular diseases. Rather, we have large patients, large database of patients. No, these days kidney disease is so common, and most of the kidney disease patients, many of them, if they require dialysis, so for the effective dialysis, for a long-term dialysis, they would require some kind of arteriovenous fistulas. So Dr. Desai, who's doing a lot of work on AV fistula, I would invite Dr. Desai to answer this question, that which specialist makes AV fistula for hemodialysis, and please tell us what is AV fistula and why it is required for dialysis.
Yes, I think this is an important sector with the growing number of patients requiring dialysis. Uh, Dialysis, as you all know, is just taking out your blood and putting it through a machine, purifying and doing what the kidney does, the machine does, and then putting the blood back. That is dialysis. But unfortunately, to getting an access to the blood in the body and a continuous access, sometimes you require dialysis 3 times a week. So it's not very easy to get access to the blood to remove the entire 5.5 liters and put it back. So for such activity, we create a fistula where when we connect an artery and a vein, so that the vein becomes much thicker and it can take cannula punctures repeatedly, and that can be used for years together. And patients are relatively pain-free, and it creates a good amount, and a good fistula created tends to uh, keep the dialysis going on for years to come. So access basically is creating a line wherein you can get the blood out from the body and put it back. That is AV access, what is done. Your second question, Vijay, was who is to create the fistula, right? Yeah, I mean, in anything, I think whosoever is, any technically good creates a fistula. I can learn fistula. If I don't know, I sit 3 weeks with somebody or 2 weeks with somebody, I can learn how to do the fistula. But here the question, it's not the question of who creates. I think what we should realize is, doing a procedure is not important. What is important is whether it needs it, whether the complications of the procedure can be handled. It's not a technical job. So if the question is who can create, anybody who trains can create. But who should be creating? We are in a system where we undergo qualification, we undergo training, we undergo certain kind of certification which happens after learning what is to be done. So what is important here is a person who can handle medically, technically doing the procedure, and also any complications arising out of it is the person who should be creating the fistula. And as I see it, I think we as vascular surgeons have it in our curriculum, wherein we are required to learn anastomosis, which is primarily our basic function. And that is why we can not just create fistulas, native fistulas, we can create grafts, we can put in perma catheters, we can put in CAPD lines. So I think when we say who creates, it should be somebody who can offer all kinds of treatment, should be the right person who will probably be in a better position to judge what kind of access a patient needs. So if I just go learn and come AV fistulas, it's like, if the hammer is the only, it's the only tool, everything is a nail. So if I learn fistulas, I'll just do fistulas. I may not even consider this patient for anything else. So I would say somebody who's qualified across, who is trained to deal with its complications, who can manage even medically, endovascularly, surgically, everything associated with fistula, should be creating the fistulas.
You rightly said, we need a doctor who is comprehensive in all modalities of treatment to treat those fistula and its related problems. Fistula is a lifeline for kidney disease patients requiring dialysis. And it's an appeal to those patients that you should see, at least you should involve vascular surgeons the day you are diagnosed with kidney disease and you require hemodialysis, because vascular surgeons are an important team member who would advise you, would guide you rightly that fistula should be made in time or what are the other options for the hemodialysis. I would invite Dr. Gupta to answer these questions. That we have discussed in nearly an hour time about various vascular diseases, arterial diseases, venous diseases, dialysis related problems, vascular problems. Now tell us why. As you said, that varicose veins, DVT, fistula, or for that matter, many arterial problems are treated by various doctors, vascular surgeons, radiologists, cardiologists, etc. There's a turf war going on. It is not about turf war. It is about, rather than, we have to be very cooperative and accommodative. Why vascular surgeons are the best doctors to treat all these problems? Please enlighten us about that. Tell society that why vascular surgeons are the best doctors.
I think it's a very relevant question in this era where everybody is trying to get their finger into the pie or whatever is available. When a person wants, let's say, a tap fitted in the house or a door repaired in the house, they ask 10 people when a plumber is recommended or a carpenter is recommended that is he good? Will he do the right thing? Will he do it on time? But when it comes to dealing with surgeons or surgical procedures or medicine, I mean, nobody actually even tries to find out whether the person you're going to is the right person to be treating your problem or even looking at you. A vascular surgeon is the right person to deal with vascular problems simply because he or she is the only one who understands vascular diseases. Other specialists probably understand a block in the artery. Maybe they see a varicose vein, they understand, okay, this is a varicose vein. But who really understands the patient? Who really understands the entire vascular system? What is the pathophysiology? How a particular disease is going to behave? How a particular treatment is going to actually impact the patient? What can the patient actually afford in terms of treatment? Are there cheaper ways or less expensive ways to treat a patient? Because I have all modalities available in my armamentarium, I am the right person to treat a vascular patient. I mean, it would be really quite silly for somebody to be seeking treatment with other specialists when a vascular surgeon is available to see, diagnose, and treat that patient. So to me, it's a no-brainer. Because we care about patients and not about lesions, vascular surgeons are the right people to treat vascular diseases.
Thank you very much, Dr. Gupta, for sending a very clear message to the society. I think we are coming to the end of the program. I would like to thank viewers, listeners, and participants. Thank you very much for spending your time with us. I would also like to thank all my panelists, senior members who shared their experience and wisdom about the common vascular problems and gave very useful and important message to the society. I would also like to thank the team of Voice of Healthcare and Trizone, our media partner, for organizing and facilitating this event. Thank you very much, friends and viewers. Hope to see you again with similar kind of very informative meeting. Thank you once again.
Thanks,
Thank
Vijay.
you. Thank you.
Thank you, everyone. Bye-bye.
Thank you.
Thank you.